Kathy, do you need to do anything else to get a list of the people that are on this call?
No, I can see who joins virtually, but right now, Donna, you don't have a quorum. You have 3 in room 114 and yourself makes 4.
That is right.
We have 4 in room 114.
Oh, who else? Oh, who? So John, Adam, and is
And Laura.
Lee there?
Yes, Lee is right next to me.
Oh, okay. Thank you. I didn't hear Lee. Okay.
Yeah, we didn't know he was there. So
Can't hear, can't see.
no, well, the camera, the camera is not. Oh, now I see all 5 of you. Yeah, okay. All right. So as I stated before, I am going to have Kathy enter into the minutes that those present in 114 are in direct conflict with the virtual motion that was passed in the Health and Human Services Committee. And I would have her put the word hypocritical in that, but I will not be that unkind. But I think it's very interesting that you guys showed up after voting to have virtual meetings of this committee. So Kathy, we'll say that as nicely as possible, okay? I don't want to be cruel, but I do want to point out that the presence of those 4 members in the room are in direct conflict with the motion that was passed. We only have one item on this agenda, and it is the item to pass the resolution. I didn't miss, public comment. Are there any members on the call or in the room that wish to make any public comment? Hearing none, then we will move to the resolution. And Sue, would you like to lead the discussion on that resolution, please?
Sure. I'll just introduce Christy and Ashley, Christy Eggy and Ashley Normington. They are both on. They completed the grant application for the Drug Free Communities grant and were successful. So I would like to congratulate them on that. For one thing, this is a huge benefit for our community. And with that, Christy and Ashley, if you want to just do a little bit of explanation as far as the resolution and the DFC funding.
Sure. Thank you, Sue. Ashley, I'll give a start and then please feel free to jump in after. Well, good morning, committee. Thank you for allowing us to present to you and to hear what we're looking to do with the hopefully passed amended budget for the additional positions that we have written into the grant. This grant is a 5-year grant. Its title is the Drug Free Communities Grant. And after the 5 years, well, in the 5th year, we have the ability to competitively write for an additional 5 years of funding. This funding was also funding that Marshfield had, Newsy. So our county is very familiar with the process, although it's recently changed and is now housed in connection with the Centers for Disease Control, which actually aligns really well with the health department. So we are happy to see that shift as we work closely with the CDC on a lot of things. So the funding that we're looking for, or the funding that we received will fund the 0.97 FTE and the 0.5 FTE, as well as provide funding to some of our critical partners in this process, in the 5-year process. The funding is to not only maintain and strengthen our current infrastructure of our AOD prevention partnership, which is a partnership made up of many community organizations that meets regularly, and it's directly connected to our community health improvement plan, which is set forth from our community health assessment, which we have shared with you in the past. So the funding will maintain and strengthen our relationships, and in addition to that, it's focused on reducing underage drinking among youth 12 to 18 years old in Southwood County. So this funding is not countywide. Again, like I mentioned, it was in the Marshfield area for 10 years, and now we had written the funding to serve the southern part of the county. And then the other goal that this funding will accomplish is to reduce prescription drug misuse among youth 12 to 18. And so we have a whole bunch of detailed ways in which we plan to do that over the next 5 years. But these staff that we're looking to bring on will be instrumental in helping us accomplish these goals.
So I have a question, but we'll entertain a motion in a second on the approval of the resolution first. Is there a motion to approve the resolution?
So moved.
And would you say who you are, please?
Adam Fisher.
Okay, so Fisher moves. Is there a second?
Lee.
And Lee seconds it. Okay. So Christy, I have a question. Thank you very much for that overview. You said that this program was in Northwood County for 10 years. Do you have any statistics on what the return on investment was in that program and how effective it was over those years in Northwood County?
I can definitely get you the annual reports that they had put together over the last 10 years. I know the leadership of that work was through Danielle Luther and through the Center for Community, at the time was the Center for Community Outreach, under partially Rhonda Kapelke, and then at the end here, Jay Schrader. I know that they have, there's very thorough evaluation measures that are included in this grant and that have been in the past as well. I can't speak specifically to those right off the top of my head, Donna, but I'm happy to be able to provide them for you. And Ashley actually might be able to speak to that more than me. She, prior to being with us on our team, actually worked on this grant up in Marshfield.
Oh, that'd be a good perspective. Ashley?
Hi there. Thanks for having us. Yeah, I was the program coordinator for the Marshfield Area Coalition for Youth when they had their Drug-Free Communities grant. And yeah, we did track a lot of the information that is needed to show that we were moving the needle on prevention. It is very hard to prove that you are preventing youth from using substances. It's not an easy thing to do, but when you look at data such as the Youth Risk Behavior Survey that the youth were taking, we did see that we were moving the needle on substance use prevention. So over the past few years, we have seen things like underage drinking decrease. We have seen, obviously, tobacco has gone down. More recent years, there's been different trends with tobacco and nicotine products, but we could see a lot of the trends among youth definitely decreasing. And there were also things in place, you know, to not only address the youth substance use prevention, but also help with adults who are using substances as well. That's not a main focus of this grant, but it definitely is another benefit to have this funding for our community. And I'm just very excited that at one time we did have it in Marshfield. We had all 10 years, and now I'm super excited that we have this opportunity to have it again in Northwood County.
Yeah, you know, we talk about that all the time, about how it's hard to quantify efforts, and that's why it's hard to get money for public health, is because people are on election cycles and public health efforts take many years to see. So I understand the quantification of that and how difficult that is, but it's good to hear that some of the needle did move with people's thoughts about things. And you know, you hate to spend all this money. And Sue, I know you have a perspective on that because we've spoken about this before.
Yeah, it's, as Ashley said, it's super difficult to quantify prevention, but these activities are based on evidence. Their research has shown that in previous communities, the activities that we're going to be undertaking have worked and have been successful. There's another aspect to this that I just started thinking about, Christy. We may have the opportunity to work with UWSP on some new research-related initiatives. So it sounds like we're going to have access to research staff who could help us to try to quantify some of the impacts that our programming, not only here, but in other areas, are having on our communities.
And Sue, I have a 2 o'clock Zoom call with the UW folks. I may call you between now and then to get a little more information, because that may be something that I can talk to them about it too. Okay.
Yep, sounds good. We are doing some interviews and stuff today, so I'm probably going to be tied up quite a bit. But if your timing is right, we'll connect.
Okay, that sounds good.
Thank you.
Do any members of the committee that are present in the room have any questions about this grant?
Yes, I do.
Go ahead.
Question is, when we approve this with the FTEs that are going to be working on this, what is that for look like in the long run? Are we going to, after the grant runs out, are we going to have to support this program ongoing?
No, we'll operate this like we do with other successful grant applications where we're obviously hoping that we'll get another 5-year extension. So we're hoping this is going to be a 10-year initiative, not a 5. But if we aren't successful for that additional 5 years, then that funding is gone and we need to release those positions.
Yeah, Lee, just for your information, that's always been the policy of the county, is with grant funded programs, when the grant and the funding goes away, the position also goes away. And that would be regardless of department that was in. Unless I guess the oversight committee had a discussion with the department head and felt that what was going on was beneficial, and then they supported that FTE with tax levy. That's just kind of just the way it worked. So
Sometimes it slips through the crack. That's why I asked.
yeah, good question. Excellent question. Okay. Are there any other questions? Hearing none, then we'll vote on the motion. The motion is to approve the resolution that is before you and send it to county board. All those in favor say aye.
Aye.
Aye. Any opposed? Then the motion carries. Okay, I think that is the end. There's nothing else on the agenda, is there, Kathy, except adjournment?
Correct.
Okay, then I will declare this meeting adjourned at 9:12. Have a good day, everybody.
Thank you, everybody.